Did you know that there are medications that doctors prefer to avoid, but you might be taking them without even realizing the risks? Today, we're going to reveal 5 medications that are widely prescribed, yet many doctors would never include them in their own routines. It may sound surprising, but the truth is that while these medications alleviate symptoms, their long-term side effects can be devastating. If you've been taking a medication for years without questioning its real consequences, this information is vital for you. You may have thought, if my doctor prescribed it, it must be safe for long-term use. But what if the reality is completely different? Are you exposing yourself to risks without knowing? Why do doctors themselves avoid these medications? Stay until the end and discover how to protect your health with safer and more effective alternatives. Before we get started, don't forget to subscribe to the channel and turn on notifications so you never miss an update. And let us know in the comments where in the world you're watching from. We'd love to hear from you. Sleep medications, Zolpidem, hypnotics. The first medication I would avoid in the long term is sleep medications, such as Zolpidem, commercially known as Stilnox or Ambien. These medications are often prescribed to treat insomnia and are known for their quick action and short duration. However, prolonged use of Zolpidem is associated with several risks, such as falls, dizziness, daytime drowsiness, and even abnormal behaviors like senseless conversations or forgetting events. In elderly patients, the risk of falls increases significantly, and long-term use can lead to dependency. When the medication is abruptly discontinued, patients may experience rebound insomnia or withdrawal symptoms. Many people develop an exaggerated fear of not being able to sleep, which increases anxiety and worsens insomnia. Instead of relying on sleep medications, it's more effective to adopt behavioral changes and sleep hygiene practices. This includes only going to bed when sleepy, avoiding electronic devices in bed, and maintaining a consistent wake-up time, even if you've had little sleep the night before. Meditation, reading, and other relaxing activities before bed can also help. In addition to the risks mentioned, prolonged use of sleep medications can affect sleep quality. These medications can alter the natural architecture of sleep, reducing the time spent in deeper, restorative stages like REM sleep. This can lead to feelings of unrefreshing sleep, even after a full night of rest. Another problem with long-term use of sleep medications is the risk of drug interactions. Many of these medications are metabolized by the liver and can interact with other medications, alcohol, and even certain foods. These interactions can increase side effects and associated risks. It's important to emphasize that insomnia may be a symptom of underlying mental health issues such as anxiety and depression. Treating the underlying condition may be more effective than relying on sleep medications in the long term. Cognitive behavioral therapy, CBT, is an effective non-pharmacological approach, helping patients modify thoughts and behaviors that contribute to sleep problems. Other strategies to improve sleep include creating a comfortable sleep environment, engaging in regular physical activity, avoiding intense exercise close to bedtime, limiting caffeine and alcohol consumption at night, and managing stress with relaxation techniques like deep breathing and yoga. In cases of chronic or severe insomnia, it is crucial to seek medical guidance to evaluate underlying causes and determine the best treatment. While sleep medications may be necessary in some cases, it's important to weigh the risks and benefits of long-term use and explore safer, more sustainable alternatives whenever possible. Painkillers, non-steroidal anti-inflammatory drugs, NSAIDs. Second on the list are painkillers known as NSAIDs, or non-steroidal anti-inflammatory drugs, which are among the most widely used medications globally. Examples include Loxonin, Loxoprofen, Voltaren, Diclofenac, and Ibuprofen, some of which are available over the counter. However, the use of NSAIDs is associated with several risks, such as heart complications. Data from large studies show that prolonged use of these medications can increase the risk of heart failure by around 20%. The higher the dose and duration of use, the greater the risk. Additionally, many of these medications cause gastrointestinal damage, including ulcers and bleeding in the digestive tract. In more severe cases, stomach or intestinal perforations can occur. Most cases of bleeding ulcers are caused by prolonged use of NSAIDs. Another issue with long-term NSAID use is their impact on the kidneys, which can reduce kidney function and cause fluid retention and swelling. Although not all users experience visible swelling, It is estimated that 5% of people show noticeable signs. It's important to limit the use of these medications and address the cause of the pain, such as knee or back problems, rather than relying on long-term painkillers. In addition to heart, gastrointestinal, and kidney risks, prolonged use of NSAIDs may be associated with other side effects, such as dizziness, headaches, and allergies. Some people may develop severe allergic reactions to these medications, with symptoms like skin rashes, difficulty breathing, and facial swelling. While NSAIDs are effective at relieving pain and inflammation, they do not treat the underlying cause. Seeking medical advice to treat the source of the pain is crucial, rather than relying solely on medication to manage symptoms. Safer and more natural alternatives for pain relief include relaxation techniques, low-impact exercises, physical therapy, and acupuncture. Lifestyle changes, such as maintaining proper posture, engaging in regular physical activity, and keeping a healthy weight, can also help prevent and relieve chronic pain. In cases of acute pain or when NSAIDs are necessary, it's essential to follow medical advice and adhere to recommended doses and treatment durations. Indiscriminate and prolonged use of these medications can pose serious health risks, so it's important to be aware of the potential side effects and seek safer alternatives whenever possible. Statins, cholesterol-lowering medications. The third medication I would avoid taking long-term is statins, used to lower cholesterol levels. Statins are often prescribed to reduce the risk of heart disease and were discovered by a Japanese scientist, Dr. Akira Endo. Considered one of the greatest medical discoveries, they can reduce the risk of heart disease by 30% to 40%, according to some studies. However, it's important to understand how this data is interpreted. In a large study on statins, about 3% of participants who didn't take the medication had heart attacks, while that number dropped to 2% among those who did take statins. This represents a relative reduction of 30%, but in absolute terms, it's only a 1% reduction. To prevent a heart attack in one person, many others need to take the medication without direct benefits. Additionally, statins can cause side effects, such as muscle damage, rhabdomyolysis, and mitochondrial dysfunction, as well as an increased risk of hemorrhagic stroke. While it's important for people who have already had a heart attack to continue taking statins, for those with high cholesterol alone, lifestyle changes may be a healthier and more effective alternative. Personally, I would avoid the long-term use of statins if high cholesterol were the only problem, without other cardiac complications. Another potential side effect of statins is an increased risk of type 2 diabetes. Studies suggest that prolonged use of statins can increase the risk of developing diabetes by up to 50%, which is concerning as diabetes is a significant risk factor for heart disease. Statins can also affect cognitive function in some people. Some users report memory problems, confusion, and difficulty concentrating during long-term use of these medications. While these side effects are reversible after discontinuation, they can be bothersome and affect quality of life. It's important to note that statins may be necessary and beneficial for people at high risk of heart disease, especially those with a history of heart attacks or other serious cardiovascular issues. However, for individuals with high cholesterol as the only risk factor, it's crucial to consider alternative approaches before resorting to long-term statin use. Lifestyle changes, such as adopting a healthy diet rich in fruits, vegetables, whole grains, and healthy fats, along with regular exercise, can be effective measures to reduce cholesterol and improve heart health. Managing stress and avoiding tobacco are equally important. Before starting or stopping statins, it's essential to consult a doctor to evaluate the risks and benefits. Every person has unique health needs, and a healthcare professional can guide you on the best approach to manage cholesterol and reduce the risk of heart disease. Proton pump inhibitors, PPIs, stomach acid reducers. The fourth and final medication I would avoid long-term are proton pump inhibitors, PPIs, such as omeprazole, commonly prescribed to treat acid reflux and stomach ulcers. These medications reduce the production of stomach acid, which can relieve reflux symptoms and promote ulcer healing. However, prolonged use of PPIs is associated with several risks, including vitamin B12 deficiency, poor absorption of magnesium, calcium, and iron, an increased risk of pneumonia, osteoporosis, and even gastric cancer. These medications can weaken the stomach's natural defenses, allowing pathogens to enter the digestive tract. Studies show that drinking water regularly can provide temporary relief from acid reflux symptoms, similar to medication use. Therefore, rather than relying on long-term PPI use, it's better to address the underlying cause of reflux, such as excess weight or poor eating habits. For many people, lifestyle changes can be as effective as medication in controlling reflux. Another concern with long-term PPI use is the risk of drug interactions. These medications can interfere with the absorption and effectiveness of other treatments, such as blood thinners, antidepressants, and osteoporosis medications, which can lead to severe complications. Furthermore, studies suggest that prolonged PPI use may increase the risk of infection by Clostridium difficile, a bacterium that causes severe diarrhea. This occurs because PPIs alter the natural balance of bacteria in the digestive tract, creating a more favorable environment for harmful bacteria. While PPIs may be necessary for certain conditions, such as stomach ulcers or erosive esophagitis, they should not be used indefinitely without medical supervision. If reflux symptoms persist, other treatments, such as H2 receptor antagonists, e.g., famotidine, or antacids, can be considered. If PPI use is necessary, it's crucial that patients are monitored and that the dose and duration of treatment are minimized. Patients should be advised not to abruptly discontinue PPIs, as this can lead to rebound acid production, worsening reflux symptoms. Diabetes medications, SGLT2 inhibitors. The fifth type of medication I would avoid long-term are SGLT2 inhibitors, used in the treatment of type 2 diabetes. These medications block the reabsorption of glucose by the kidneys, causing excess glucose to be eliminated through the urine. This helps lower blood sugar levels, but also increases the risk of urinary and genital infections, especially in women. Additionally, excessive glucose loss can lead to weakness, fatigue, and dehydration. While these medications may benefit patients with diabetes and heart or kidney diseases, it's important to attempt to control diabetes through diet and exercise before relying on long-term medications. Another potentially serious side effect of SGLT2 inhibitors is an increased risk of diabetic ketoacidosis, a condition that occurs when the body produces high levels of ketones due to a lack of insulin. While more common in patients with type 1 diabetes, diabetic ketoacidosis can also occur in patients with type 2 diabetes who use SGLT2 inhibitors. Symptoms include nausea, vomiting, abdominal pain, confusion, and shortness of breath. If left untreated, diabetic ketoacidosis can lead to coma or even death. Furthermore, SGLT2 inhibitors may increase the risk of amputations of toes or legs. This risk is particularly high in patients with peripheral artery disease or diabetic neuropathy. It is crucial for patients using these medications to carefully monitor their feet and legs and immediately report any sores, ulcers, or infections to their doctor. It's important to emphasize that for many patients with type 2 diabetes, lifestyle changes, such as adopting a healthy diet, exercising regularly, and maintaining a healthy weight, can be sufficient to control blood sugar levels. Even modest weight loss can significantly improve insulin sensitivity and reduce the need for medications. When lifestyle changes aren't enough to control diabetes, other medications, such as metformin, can be considered before resorting to SGLT2 inhibitors. Metformin is typically the first-line medication for treating type 2 diabetes, as it is effective, safe, and well tolerated by most patients. If SGLT2 inhibitors are necessary, it's essential for patients to be closely monitored for any side effects or complications. Patients should be advised to drink enough fluids to avoid dehydration and to immediately report any symptoms of urinary or genital infections, diabetic ketoacidosis, or problems with their feet and legs to their doctor. In summary, it's important to address the underlying causes of health problems rather than simply masking symptoms with long-term medications. While medications may be necessary in some cases, such as for people who have already had a heart attack or are at risk of kidney failure, it's always better to try to change lifestyle habits to improve health. If you have anything to add, please share it with us in the comments. Don't forget to subscribe to the channel. I'm leaving 2 videos on the screen that I'm sure you'll enjoy. See you there.